Welcome, and thank you for joining the American Red Cross Northern California Coastal Region Speaker Series session. My name is David Cruz, and I'm honored to be today's moderator. We are grateful to have you join today's conversation and hope you'll leave more informed and inspired about the work of the Red Cross. Today's session is being recorded, and you are in listen-only mode, so we can give full attention to today's speakers. If you have any questions or comments throughout the session, feel free to submit them in the chat box, where I will review and compile them. Our speakers will try to get to as many of them during our question and answer session towards the end of the program. Remaining questions will be answered in a follow-up email along with a recording and a survey. Today, you'll hear from 4 outstanding speakers who will share a few updates and stories on the work of the American Red Cross is doing across the globe in what we call international services. With that, I'm honored to introduce our first speaker, Chris Losavio, Executive Director of the Heart of the Valley Chapter, Northern California Coastal Region. Chris has been in the social services and nonprofit field for over 15 years in several leadership roles. His tenure with the Red Cross began in 2013 during Hurricane Sandy, and in 2015, he served as the Regional Director of Client Services and Recovery for the Greater New York region, one of the busiest disaster regions in the US. Before moving out to California to join our region in 2020, Chris served as the Regional Director for the Service to Armed Forces and International Services Program in New York. Thank you and welcome, Chris.
Thank you so much, David, and thanks for having me here today. I really appreciate it. And good afternoon, everyone. I want to sincerely thank you all very much for joining us here for what I think is going to be a very exciting and informative hour about our Red Cross International Services programs. You'll be hearing from some of my personal Red Cross heroes who will be sharing about the incredible and mission-driven work that they and their teams are doing on a daily basis to serve our international community, both at the local level and globally as well. But before we jump into all that, I was asked to briefly share a little bit about our Red Cross history, our programs and services, and community impact to provide a bit of context for the rest of today's presentation. So if this is your first meeting with us today, first I want to personally welcome you to the family. I hope you find something that inspires you today. And if you're a seasoned Red Crosser, welcome back. And I hope you learned something new about today from this important work. Some of you may not know, but when the Red Cross was first chartered by Congress in 1905, the mission statement, which is to prevent and alleviate human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors, soon became the focal point for motivating all the operations our organization carries out on a daily basis. This mission statement is truly the heart and soul of the organization and guides the work we do on a daily basis. And since then, the Red Cross has expanded into 5 distinct lines of service with an extensive community-based network that has provided life-saving assistance for more than 140 years. All of these branches of service work cooperatively to both fulfill the mission as well as promote our values. The first line of service, and one of the most well-known, is our disaster cycle services. Disaster Services, or DCS, works diligently on a day-to-day basis to provide support to families and communities following emergencies. Our teams respond to anything from a local home fire to a large-scale disaster like a wildfire or hurricane. We provide support through 3 core mission areas: prepare, respond, and recover. In preparation, we teach classes about emergency preparedness aimed to decrease human suffering and impacts of disasters. We help our communities build things like personal home fire escape maps, learning proper placement of smoke alarms, how to make communication plans, emergency kits, and so much more. We also install free smoke alarms to households in need to better prepare our communities, and as you can see in the slides, quite literally to save lives. In response, on any given day, regardless of what type of disaster strikes or disaster action teams are deployed on site, stationed at shelters, or just on standby at local Red Cross chapters to help those affected to receive comfort and care and support as food and basic resources they need immediately following the disaster. Their primary focus is to meet the immediate disaster caused needs of individuals and our community. And lastly, in recovery, our disaster caseworkers assist individuals and families with their next steps, such as recovery planning, general problem solving, providing referrals and advocacy, and connecting to folks to mental health, and spiritual care teams and resources when needed. The next line of service is the Service to Armed Forces, or SAF, which is our oldest line of service. This branch of the American Red Cross focuses on providing support to America's military and veteran families, including active duty service members, veterans, and their families. We have a variety of services in place from the moment someone enters into the military, supporting they and their families throughout their military career, to the time they retire and receive services at their local VA. Some of these services include providing 24/7, 365 emergency communication services, which helps families connect with a loved one that's deployed when an emergency happens back home. Casework services, we have caseworkers across the country that help navigate local community resources for service members, veterans, and families day in and day out. We provide deployment and reconnection workshops, which are small group workshops provided by licensed mental health facilitators to help service members and their families cope with challenges of deployment and reconnecting upon return from deployment. We also have a variety of support to our veterans and local VAs, and support through our awesome military and veteran caregiver network. Our services provide a consistent support throughout their career and into retirement. Our next line of service that we wanted to mention is training services. In an effort to help save lives and strengthen communities, the American Red Cross has a history of providing opportunities to be trained in many of the most useful life-saving skills, from first aid and adult child CPR and AED certifications to swimming and lifeguarding and babysitting training. These all enable those certified to prevent, prepare for, and respond in a number of life-threatening scenarios and help save lives. The next up is our Blood Services Program, which is one of our most well-known of the 5 lines of service in the American Red Cross. And it provides life-saving blood supply of 3,000 to 3,000 different hospitals and transfusion centers and medical facilities every single day. We are the United States' largest single supplier of blood and blood products, collecting 6.5 million units of blood annually. In order to maintain supply that meets the demands of patients in need, the Red Cross relies on blood donation centers and blood drives held on a regular basis at schools, businesses, and community centers, as every 2 seconds someone in the U.S. needs a blood transfusion. And then lastly, and most importantly, we have international services. So finally, we have our international services program, which we are most excited to take a deep dive into today's session. Alongside 191 other national societies, we have programs and services that are focused to support people in our local communities as well as internationally. I know Koby will be taking a deeper dive into these specific programs and services this afternoon, but in a nutshell, at the local level, we're providing our Restoring Family Links program, which aims to reconnect families that have been separated by conflict, disaster, forced migration, and other humanitarian crises. We also provide an international humanitarian law education. So one of the duties of all Red Cross and Red Crescent societies is to educate the American public on the rules of war. And this type of law is really meant to limit the effects of armed conflict and to ensure the safety and dignity of people in times of war. We provide our International Humanitarian Law Youth Action Campaign, which is to empower our youth ages 13 to 24 to raise awareness about IHL, or International Humanitarian Law. Another program we do at the local level is Measles and Rubella Initiative, which is aimed to educate the public and raise funds to combat measles, which is an extremely contagious and deadly disease that takes hundreds of lives of children around the world every day. We also engage with local consulates to inform them about disaster preparedness and build strong partnerships. And then lastly, our Missing Maps program, which is a collaborative project to better map disaster and conflict-prone areas of the world, so humanitarian aid workers have workable maps and can provide better and more efficient services. Internationally, alongside 191 other national Red Cross and Red Crescent societies, we also support the global movement. When disasters and other humanitarian crises arise internationally and there's a need, American Red Cross volunteers are deployed to support these locations in a variety of ways. To give you a broad overview of international services work, it's really important to understand the three main components that make up the International Red Cross and Red Crescent movement. There are 192 national Red Cross societies around the globe, including the American Red Cross, each uniquely chartered to operate within their respective countries. The range of services provided by each society varies depending on the needs of the country, but can include disaster preparedness and relief, health and social initiatives, and aid to those locally affected by war. Each national society also promotes humanitarian values and advocates for the vulnerable within its country. Next is the International Federation of Red Cross and Red Crescent Societies, or IFRC, which coordinates international assistance efforts in response to natural and man-made disasters that are unrelated to war. The IFRC's main mission is to improve the lives of the vulnerable by mobilizing the capable. The IFRC also strives to teach disaster preparedness, fight the spread of disease, discourage discrimination and violence, and promote humanitarian values. And then lastly, the last component is the International Committee of the Red Cross, or ICRC, which has the primary function of protecting and assisting the victims of war and conflict while remaining impartial and neutral. The ICRC also attempts to prevent suffering through the promotion and adoption of universal humanitarian laws and principles throughout the world. Bound together by the Red Cross mission and our 7 fundamental principles, all 3 entities work together or complement each other's actions. The emblems of the Red Cross, Red Crescent, and Red Crystal serve to protect against misuse and abuse, always stand as symbols of neutral and independent assistance, and are guarantees of protection in times of conflict or disasters to affected individuals. So as you can see, we are a very large humanitarian organization doing a lot of great work. Our global, regional, local capacity is truly incredible. Our upcoming speakers will provide insight as to how we work in coordination with the ICRC and IFRC on a local and regional level to ensure there is movement-wide coordination on policy development, advocacy to serve those in need. You'll also hear from Christine Medeiros, one of our exceptional mission moment speakers and volunteers, who will share a few stories of how this all comes into play on a local level. And I'd be happy to answer any questions about our local and regional impact during the Q&A session, but I really appreciate a few minutes of your time today, and I hope you enjoy this awesome presentation today. Thanks.
Thank you for providing that overview of the Red Cross lines of service and a bird's eye view of the Red Cross and Red Crescent movement, Chris. I'd now like to introduce you to Koby Langley, Senior Vice President of Services to the Armed Forces and International Services for the American Red Cross. Koby Langley provides oversight and direction for American Red Cross programs around the world, with a focus on global elimination of measles and rubella and international disaster preparedness, response, and recovery operations for communities in need. In addition, Langley oversees the worldwide support provided to service members, veterans, and their families, the oldest congressionally chartered mission of the American Red Cross. Koby previously served as the Director of Wounded Warrior, Veteran and Military Family Engagement at the White House and Senior Advisor for Wounded Warrior, Veteran and Military Family Initiatives for the Corporation for National and Community Service, leading the largest expansion of services and grants for veterans and military families in agency history. Koby is a 2-tour combat veteran and Bronze Star recipient for meritorious service. Welcome, Koby.
Thanks, David, and thanks, Chris, an exceptional leader, a leader amongst leaders in the American Red Cross, certainly. I also want to say a special thank you to the team that put this together. Pooja and the rest of the team has just done an exceptional job of putting together a wonderful slate. I'm excited about the opportunity to talk to you all today. I'm especially excited to talk to you about an aspect of the American Red Cross that's central to our mission, but sometimes isn't necessarily in the forefront of everybody's mind, and that is, as Chris mentioned, our international services. You know, Red Cross chapters everywhere around the country have made the American Red Cross a truly hyper-local organization. And that hyper-locality, that localization effort is the way that we operate all around the world. And it's an important aspect of what we do for good reason, because as we become a part of the communities that we serve before, during, and after disaster, we can better serve the clients that we need to reach. But just as Chris talked about, our mission is worldwide, and as a result, it's the global Red Cross and Red Crescent that has this wide breadth of services and collaboration amongst the other 191 national societies, and it's working with that network that allows us to have the best impact possible. So as the world's largest humanitarian network providing services to the most vulnerable, it's incumbent upon us to provide assistance whenever we can and wherever we can. So how do we do that? A few different ways, but principally through this really delicate dance between preparedness, response, and recovery. It's the same construct that we operate in domestically, simply because although we can't necessarily prevent all disasters, we can certainly bolster our international network towards strategic planning, mitigation, and sustainability at the local level. We do this with the support of lots of partners, many of whom have joined the call today, and quite a few that have employees in many areas internationally. So for the folks that are joining us internationally, and particularly for those team members that are working with us on the ground globally, I'd like to say thanks for joining us. And I also want to share a little bit more about what we do specifically with these partners around preparedness, disaster response, and disaster recovery. So I want to start with preparedness. We have 10 priority countries in which we operate our disaster preparedness programs internationally. Many of those are located in the Asia Pacific region along what I like to call Cyclone Alley. So these are the countries like Bangladesh, Myanmar, Nepal, the Philippines, Indonesia. Those are areas and contexts in which we operate pretty regularly because of their unique disaster profile. We also operate in South America and Central America as well, and in places like El Salvador, Guatemala, and Honduras, and Colombia. No disaster is the same, but it's through continuous evaluation and best practices, working hand in hand with those local Red Cross and Red Crescent societies, taking an assessment of each event, the impact of each disaster, and talking to that host national society about an opportunity to strengthen their own organization to be able to provide services to the most vulnerable. These partnerships, these preparedness partnerships, help us to equip the communities with sustainable, cost-effective solutions to keep their neighbors safe and to be prepared for the next disaster. So when we talk about preparedness, this comes in the form of things like early warning operations, early warning mechanisms, training individuals on how to get into the communities and get them into safe places quickly so that they can recover. It's things like disaster response activities at the local level, from first responder and first aid training to youth preparedness activities. Our monitoring response readiness is actually a 24-hour job. Places like Colombia, the disasters that we're able to avert, it can be the regular yearly rain or drought seasons or the threat of climate change, as well as the repercussions of increased volcanic activity. All the more reason to put the resources that our work centers on more capacity building and more community building. On the response side of the house, we don't just prepare for natural disasters, but for the unfortunate results of human conflict. It's an integral part of the American Red Cross mission to respond to humanitarian crises when we can, when they take place. Our response focuses on expanding urgent relief to victims on unfunded and underfunded natural disasters. We focus on human conflict when we can with local partners and communities and other national society partners like the ICRC, who help provide these areas of expertise and leadership while coordinating with other Red Cross and Red Crescent network providers. We do things like providing financial resources, supplies for relief operations, training response specialists within the American Red Cross, and then deploying them overseas. We like to complement local capacity. We're never taking over operations or subordinating the host national society to the wishes or whims of the American Red Cross, but rather we help support them in providing technical expertise in areas of information management, communications, operations and leadership, and financial assistance, just to name a few. So when you talk about recovery, you can imagine that our recovery efforts are closely interwoven with both preparedness and response efforts. So we seek to ready communities for the future while alleviating issues of the present. Oftentimes you'll see in our priority countries this navigating between response and recovery because our teams are already on the ground. So in these complex contexts that are disaster prone like El Salvador, it's not uncommon for us and our teams to do both preparedness operations as well as recovery operations at the same time. Our programs equip communities with durable and inclusive solutions to families and institutions to help them better prepare and to be supported in the face of future hazards. Many of the specific programs that we have help to better explain the mission and mandate of the American Red Cross. One of these that touches every aspect of the American Red Cross and almost internationally integrated is our Missing Maps project. The Missing Maps project is actually the crux of understanding how to help a community before and after disaster will lie upon the community itself. So whether you're talking about engaging with communication for a displaced personnel from a natural shock or from a hazard or from a conflict, communicating during these types of shocks to rebuild efforts to provide accurate information is critical in these decision-making processes that reconnect families. So the Red Cross Missing Maps project is both an open and collaborative, thanks to the power of crowdsourcing, relying on the general public to provide information. So as an example, people can actually trace buildings and roads from satellite imagery to create detailed maps, which are then added to OpenStreetMap, which is a free and editable word map. Others can use this information on the ground or add more details like the specific locations of health facilities, water points, and schools. This information is critical, especially during disaster aid workers when they're on the ground. So Missing Maps is an outstanding program. I encourage you all to learn more about it. I also want to talk a little bit about restoring family links. So when disasters happens, our efforts to respond beyond the bare minimum shows another program like RFL is incredibly valuable to our community. You know, the concept of RFL actually dates back to the founding of the American Red Cross when Claire Barton actually carried messages between wounded soldiers and their families during the Civil War. Her first office is actually a stone's throw away from National Headquarters office to reconnect families after war and armed conflict. RFL provides a lot of services that are also encouraged for your local team members to engage in. Contact tracing was an extensive process of searching for missing loved ones. Family news, exchanging the messages between family members when there's no other means of communication. Connectivity and phone services, providing border phone calls, Wi-Fi access, and charging stations following disaster. And also making sure that we're documenting and seeking proof of time spent in detention related to armed conflict or political unrest so that we can transfer that information to the ICRC and they can then take on that role and responsibility to help reconnect those families. You know, conflicts have directly caused the most family separations and have generated the most restoring family links casework. That's why our partnership with the ICRC and other national societies that are in these complex conflict contexts is exceedingly important. Over 80% of the caseload is related to conflict zones, and that's why our partners in the ICRC are so critical to our work. We do contact tracing requests in recent conflict areas, places like South Sudan and Syria, as well as legacy contexts. We've reconnected many families from the Cold War and even World War II. So before, during, and after disaster, we're there. This is just one way that you and your partners can support. Another area I wanted to highlight is our work in measles and rubella. The American Red Cross plays a leading role in the global partnership to eliminate measles and rubella through the Measles and Rubella Initiative launched in 2001. You know, this effort has resulted in over 5.5 billion doses of measles provided. It's CDC, the American Red Cross, UNICEF, World Health Organization, and the United Nations Foundation all working together. It's a killer disease. We've been able to save over 23 million lives through this process. And this year alone, the American Red Cross helped to facilitate nearly 1 million household visits to deliver these services. That's in the height of the pandemic. Lastly, international humanitarian law. As Christopher mentioned earlier, this is an important part of our work and a critically important part of our partnership with the ICRC. The origin of it stemmed with the ICRC, then founder Henry Dunant, bringing humanity to the battlefield. The Geneva Conventions in 1949 led to a further formation of the codification of these roles and requirements. Our job is to empower youth. Our job is to teach IHL to the general public free of charge. And our job is to make sure that we're using targeted outreach and workshops to touch as many different sectors as we can. Luckily, we have one of our experts from ICRC on the phone, and he'll be able to talk more about that later, so I'm not going to steal his thunder. I want to talk about migration. It's an exceedingly important part of our mission. We have, as you see on the screen, these 10 commitments that we've made to help support the migrant populations that we serve. Migration and population movement is not just in the southern border, though, it's global. And importantly, supporting our partners on the southern border is important. It's a part of our mission. We'll continue to do that. We've committed over $1 million just this year alone, and have already supported our efforts on the border in the millions of dollars, more than just $1 million this year alone. But as I mentioned before, migration and population movement continues globally. And I want to share a personal story of a gentleman that I met in Myanmar, Lee San Shu. Lee Shan actually was living in a displaced camp of about 50 people near the border of Bangladesh, and the American Red Cross, working with the Myanmar Red Cross and the Bangladesh Red Crescent together, along with the ICRC and the IFRC, have been helping to address the largest humanitarian crisis on the globe. Lee San acts as a carpenter. He actually created this open air meeting space that we're standing under. He was able to create these through the supply and support that was provided to him by the American Red Cross and the Myanmar Red Cross. You know, the population movement that's occurring is one that will continue, and one that most importantly leverages the full power of all of us, the ICRC, the IFRC, and other national societies working together. So Patrick's team at ICRC is working on the ground collaboratively to address this issue, and he'll be able to talk a little bit more about that later on. I want to say thank you for the opportunity to talk a little bit about what we do. I'm looking forward to the continuing discussion and answering any questions you all might have. David, thanks for allowing us to talk a little bit about the work that we're doing internationally.
Thank you, Koby. For our audience, I know you may have a few questions for Koby, so just a friendly reminder to submit any questions you may have in the Q&A feature for any of our speakers. We'll get through as many as we can towards the end of the program. With that, it is my honor to introduce you to our next speaker, Patrick Hamilton. Patrick serves as the head of regional delegation in Washington, D.C. for the International Committee of the Red Cross, also known as the ICRC. In this role, he manages the relationship with the governments of the US and Canada, covering international humanitarian law, humanitarian policy, and operational matters linked to US and Canadian military action. Before taking on this role, Patrick spent nearly 6 years at the ICRC headquarters in Geneva, Switzerland, as head of the Support Relationships in Armed Conflict Initiative, 4 years with the ICRC Near and Middle East Operations as Deputy Regional Director for the Near and Middle East region, covering Iraq, Iran, and Syria, and multiple other leadership roles since joining the ICRC in 2001. Welcome, Patrick.
David, thank you very much indeed, and a huge thanks to you, to the team that's organised this. Very much want to start by echoing Koby's comments about that. It's obviously a great session you put on for everybody today, and I just wanted to start by saying a huge thank you to you, and also likewise to Koby for the fantastic relationship that we have with you and with the American Red Cross in general. So really great to have the opportunity to be with you today. I wanted to, obviously this whole topic of international services is obviously very relevant and is very much our bread and butter at the ICRC. And I think it's great that we have the opportunity to talk a bit about it today. And obviously really look forward to some of the questions that you on this call may have for us, and hope to answer some of them through the course of this presentation. I thought that it would be really good to start off with this picture on this slide that I took back in 2002 in Uruzgan province in Afghanistan at the very start of my career with the ICRC. I was working at that time as a Pashto interpreter in Afghanistan, and in this photo you can see that we were in the process of delivering a Red Cross message from a detainee that we at the ICRC had visited a short time previously, or short time earlier, and we're delivering this Red Cross message to the father of that detainee as part of our broader efforts to try and restore family links between those separated by the conflict in Afghanistan. Once he had read this Red Cross message, the father then had the opportunity to obviously write a response to his son, which we then took away with us and took to his son when we next visited him in the prison where he was being kept. In the bottom right hand corner of this photo, you can see the head of the Uruzgan Afghan Red Crescent Society chapter, who was very much with us on this visit to go and meet this family and to deliver this Red Cross message, Red Crescent message. And I wanted to start with this because for me it's very much symbolic of the fact that working with Red Cross and Red Crescent societies as part of this broader global and local movement is something that I've been doing from the very beginning of my career with the International Committee of the Red Cross, and that's been a real point of continuity across my career, which, as David mentioned, has obviously taken me through a number of years in Afghanistan, time in Sri Lanka, a number of years spent in the Horn of Africa, in Chad, in Somalia, and then also in the headquarters before arriving here in the US in Washington last summer. And of course, some nearly 20 years later, here I am speaking with you today as that point of continuity in terms of those broader movement relationships. And I think very much my career is certainly, or the experience in my career is very much a testament to the strength of what that global local network for humanity is really about, and the importance of that. So great to be with you today, and obviously to reinforce the message that as a movement we're a huge, if not the biggest, humanitarian actor out there, and we really have this amazing capacity to be able to deliver assistance and protection for millions and millions of people out there across the world. Enough about me. Who or what is the ICRC? Well, the International Committee of the Red Cross is an impartial, neutral, and independent organization whose mission is to protect the lives, to protect and assist victims of conflict and violence around the world. How do we do that? For the main part, obviously, we do that in operational contexts like Syria, Afghanistan, Yemen, Sri Lanka, Ethiopia, to give just a few examples. But whilst most of that work in terms of protecting and assisting people takes place in those operational contexts, nonetheless, we need to have presences and what we call humanitarian diplomacy work in a number of major capitals around the world due to the influence of those particular states on those operational contexts. And that means that we have offices and representations, obviously, here in DC, as well as in places like Brussels and London, Paris, Moscow, Beijing, Riyadh, Tehran, and elsewhere to be able to ensure that we have a dialogue, a humanitarian dialogue with these states that obviously have really important levels of influence over the fate of people in places like Ethiopia, Syria, Yemen, and so on and so forth. So obviously that's a kind of basically how we work, this tandem approach of operations versus then humanitarian dialogue. In terms of our presence, we have a presence established in more than 100 countries around the world, and have today in 2021 some 20,000 staff members working across the world. And similarly, we have a budget of around about just over $2 billion Swiss francs in 2021, so a very similar budget and size to the American Red Cross, but obviously that budget is then spread across the world, and we'll come back to that in just a second. Sorry, if you go back to that previous slide. In terms of our operational focus, this slide and map obviously gives you a sense of where our primary operations are. Obviously, some of those that I've just mentioned, you can see in the Americas that our biggest operations are in Colombia and in Venezuela. We also have important operations in places like Ukraine, Myanmar, as well as in the Sahel and Lake Chad region. Something I think that's really worth mentioning as well is that for the main part, in an awful lot of these contexts where we work, we've been in these places for, on average, around about 35 years. And that demonstrates the increasingly protracted nature of the conflicts in which we are operational, and the difficulties that the international community faces to actually bring lasting peace to these contexts. And whilst we had all obviously hoped that the COVID crisis might actually help bring opportunities for peace around the world over the course of the last year, or at least ceasefires, instead what we've seen is that actually there have been a number of outbreaks of new conflict in a number of contexts, like Nagorno-Karabakh, Ethiopia, Mozambique, Central African Republic, and you can see them obviously colored in red to indicate that these are conflicts that have obviously escalated over the last year, and places that we're obviously particularly concerned about today. In terms of that budget, as I mentioned, so around about $2 billion, just over $2 billion that we spend around the world, or will spend around the world in 2021. The main focus of that budget will obviously be in Africa, as well as in the Near and Middle East. Africa, the Africa region for us represents around 40% of our $2 billion expenditure, with Near and Middle East coming in at around a third of what we spend around the world. So obviously those two regions and the level of humanitarian concerns that exist in them obviously represent the primary concerns today for the ICRC. But clearly we have obviously important expenditures in Asia and the Pacific region, as well as in Ukraine and Colombia, Venezuela, and the Americas region, as already mentioned. And in terms of those, the way that that budget is spent, to give you just a couple of figures. So in last year, we visited over 1 million people in detention around the world. We supported just under 1,000 hospital and health structures around the world. We provided some food assistance for nearly 5 million people in these contexts, and provided access to clean water for nearly just over 34 million people around the world. That's just to give you a few figures for some of the activities that we deliver in these contexts. Here in the US, we are a small team of 40 people, and we obviously look to engage in particular in that humanitarian diplomacy work, meeting obviously with key US governmental officials across Congress, the White House, State Department, Department of Defense, and the Pentagon, as well as then with military officials, academics, think tanks, companies, and global media. And indeed, the smiley face at the bottom of this slide is our colleague Mark Silverman, who actually is based out in San Francisco and is responsible for leading our engagement with US tech companies out in San Francisco, and working on issues like misinformation, disinformation, and hate speech, which is obviously an emerging issue, not obviously just here in the US, but also in particular in some of these conflict contexts where we work. And so Mark obviously collaborates with our American Red Cross colleagues out in your chapter doing some of that work. Beyond that, though, obviously in the US, beyond engaging just with government, we obviously look to engage also with civil society actors on issues such as climate and conflict, the way that climate change is impacting on places of conflict and people affected by that, as well as things like how to get COVID vaccinations into areas controlled by non-state armed groups in conflicts in which we work. Healthcare in danger issues, how to protect healthcare workers and infrastructure in conflicts today as well. So there are a number of sort of big thematic issues that we obviously try to dialogue with or dialogue on here in the US with these, more broadly out and beyond the dialogue that we have with the US government. And just to mention that we obviously have operational activities, in particular in Guantanamo Bay detention facility in Cuba, where we've carried out now 135 visits over the last 19 years, as well as then obviously our interaction with American Red Cross, as well as then the partnership with the Mexican Red Cross on the other side of the border over these broader issues of immigration and migration, and where we're obviously concerned about delivering support to those suffering humanitarian consequences of the approaches there. Obviously, there are numerous activities that we carry out on our own, just as the American Red Cross, but there are also a number of areas where we clearly look to collaborate as well. And here on the slide, obviously, you can see a few of those. Clearly, there's an interest, as already mentioned, to collaborate over international humanitarian law and the dialogue and the promotion of international humanitarian law here in the US. Equally around these policy issues like protecting healthcare in conflict, or on COVID, the COVID vaccination, as well as then obviously interacting over the restoration of family links, and my approach to migration, communications, digital transformation and innovation, fundraising, and then obviously we're also looking towards an international partnership over a project in Central America. So obviously we act on our own, sometimes in complementarity, but often also joint. Really, there is a great strength to working together. Maybe very just quickly, looking at the Americas, this slide shows you our presence across the Americas more broadly, obviously here in the US and in Canada, but you'll see obviously that the ICRC maintains a strong presence out across the region, even if that budget expenditure obviously is nowhere near what we spend in Africa or in the near Middle East. But nonetheless, in the last year, we facilitated some 83,000 phone calls between migrants and their families at 53 points run by the Mexican Red Cross through their migrant shelters. We supported infrastructure improvements to 10 shelters that benefited nearly 27,000 migrants, and we carried out visits to people, to some 11,000 people in detention out across the Americas region, obviously implicating a number of people that had been displaced or indeed were migrants themselves. So that's just to give you a few quick snapshots of the kinds of activities that we are engaged with here in the broader Americas region, and some of the support that we provide with our Red Cross partners here in the US, and obviously more broadly to those populations that are affected by armed conflict, violence, and obviously find themselves as migrants as well. I'll stop here. A huge thank you again for the opportunity. Looking forward to your questions, but just to say again, a huge thank you for being able to address you today, and a huge thank you to Koby, to David, Pooja, and the others at the California chapter for this opportunity today and for our collaboration in general. Thank you.
Thank you, Patrick. We appreciate the wealth of information on the role of the ICRC and the partnership with the American Red Cross and other Red Cross societies. Now, I would like to introduce to you our mission speaker, Christine Medeiros. Recently retired from the technology industry after 40 years in marketing and partnerships, Christine Medeiros volunteers in local, regional, and divisional roles with the Red Cross. She serves as the reunification lead for the Red Cross North Bay chapter, most recently working on cases for Hurricane Laura and the California and Oregon wildfires. Christine is also the regional and divisional lead for the Restoring Family Links program, where she promotes the Red Cross's unique role in reconnecting families around the world who have been separated through war, natural disaster, forced migration, or other humanitarian crisis. A volunteer for 3 years, Christine is the recipient of 2 2020 Red Cross Pacific Spirit Awards and the 2019 Marin County Leadership Award. Welcome, Christine.
Thank you, David. Well, hello, everyone. It's absolute pleasure to be here today, and thank you so much of coming here to hear our stories about working in international services. So I'm the volunteer here. Okay, and as many volunteers, I started out on the disaster side because I didn't want to be a spectator during the next California wildfire. So I am a disaster responder, but as you heard today, I discovered there's much, much more to the American Red Cross. In fact, the work that I do, reconnecting immigrant families, has put the Red Cross in a total new light. This bigger and brighter light. I mean, even our fundamental principles and our history never meant more to me than now in my work. Like you heard, it started out with Clara helping soldiers from the North and the South to try and reconnect back with their families who'd also been displaced. And it's actually written into the Geneva Conventions as Article 26 and 27. Now, I usually show a video at this point, but we're running behind, so we're not going to show it, but the link will be sent to you. But it's a great story about a Vietnamese man who came, ends up here as a refugee, never hearing from his family for over 40 years, but they had never stopped trying to find him. And I always show this video and it still brings tears to my eyes. And I think maybe it's because I was a child of the American war in Vietnam, and just this idea that I could help and heal a family that's been torn apart by this war has meant so much to me. In fact, we have many Vietnam cases and I work very hard on those cases. But this is what we do. We put together these missing pieces. These family connections are literal lifelines, especially for some of our elderly clients who are here all alone and they've lost contact with their families back in their homelands, or they're victims of exploitation and abuse because of their immigrant status. So as Chris laid out earlier, the core services are searches and messages. We initiate searches in other countries and we conduct searches here. Or if communications have been abruptly cut, whether it's because of a war or a disaster or a family member just suddenly goes dark, a Red Cross message may be the only way to get a message through. And can you imagine, for an asylum seeker who's living in fear of his government, it can be the only safe and secure way to get a message out. And remember, if there's a war or disaster, it's the International Committee or it's the Federation who's already on the scene working with a local society, whether they're visiting prisoners of war or they're running the refugee camps and shelters. It's a very powerful network for us because that's how we can do what we do. So in Northern California coastal region, we have 10 active caseworkers. And we get around a case a week since last September. We were getting one a month, but there has been a great uptick. As you see from this country list, we have a quite variety, but it really reflects the natural trends. Lots of Central America, but also many African cases. And every case is a unique story. And as the Red Cross works very hard to protect the privacy and the personal data of our clients, I can only talk about my cases at this highest level. As you can, imagine, these stories are very sensitive, they're very personal, and they're actually very traumatic for them to have to retell to us. So many of them have no interest in promoting them, but we have many great stories to tell. In fact, I'll never forget one story from the International Committee, a father's quote, "If you can't run, you can't flee." And he was heartbroken because he had to leave an elderly mother behind and a toddler. So that just shows you just the heart-wrenching, what happens here. So currently we have cases for South Sudan, Portugal, Ghana, Honduras, Armenia, the Vietnam War, and we have many Ethiopian and Eritrea cases because of the conflict in the Tigray region. We had over 20 inquiries just in our area. My very first case was a missing Ukrainian in San Francisco, or my first Vietnam case, a man looking for his refugee brother in Canada. Adopted woman in Roseville who did a 23andMe and discovered she was actually Iranian and wanted to search for her mother. So on the top of this great satisfaction of helping these families, you have to do cultural and historical research, so you can understand the circumstances and put it all in context. You learn that Angola has had constant wars for 35 years and 500,000 children went missing. or that the Iranian terrorist group was exiled to the Albania in the 80s. There's just so many stories that you have to apply history to understand. So when we play detective here, we play detective, we use the internet, we use our partnerships. And obviously I love to talk about this service. And that's part of what I do is outreach. In fact, our region leads the nation in our outreach numbers of how many people I present to and how many people we serve. Because we need to be connected to immigrant service organizations. We belong to forums, coalitions, initiatives, so that we reach out into the immigrant community and the people who serve them, and then they can understand our services and know to refer us, or know when we're looking for someone they know to assist us. So the power of our fundamentals of being impartial, neutral, and independent is not lost on our partners or our clients. And all I want is to get their staff to start asking, are you able to connect back to your family at home? You're safe, you're here, you're getting help. Would you like your family to know? In fact, the people on this call today, have you heard a story from a friend, a coworker, heard it in the coffee shop? The Red Cross might be able to help. So thank you for letting me sharing a few stories about how we continue to, I'm always inspired to do what I do to keep reconnecting these families and making them whole again. It's your support and donations that enable us to do this work locally, nationally, and internationally. So thank you so much. Thank you, David.
Thank you for sharing those incredible stories, Christine. Those experiences are truly moving. We thank you for all that you continue to do to support our community in a moment's notice. And a big thank you once again to all of our speakers for providing such valuable information. We've had a lot of great questions come in that we'll jump right into and get through as many as we can. Our first question is for Chris. What is the process to get involved as a volunteer with the international services locally? And is there an age or language need to participate in international services work?
Oh, thanks so much, David, and thank you for the question. Yes, absolutely. So our international services teams are always looking for bright and passionate individuals like Christine to serve our communities. As you heard today, there are so many ways that you can support. The process to get involved as a volunteer with our international services team, if you're not already a Red Crosser, is quite simple. You just go to redcross.org/volunteer and sign up today. You'll be connected with a local international services volunteer manager to chat further about the available opportunities within your region. And if you are a volunteer already, you can ask your current volunteer manager and they can connect you directly to the International Services Department volunteer manager. In Northern California coastal region, that's our awesome SAFIS director, Nikki Rowe. With regards to age limits, we have a variety of volunteer opportunities for both adults and youth. One particular program that comes top of mind is Cater to Youth, is our Youth Action Campaign International Humanitarian Law program. That works to empower youth between 13 and 24 to raise awareness about IHL in the community. So, in our region this past year, we had over 60 youth in 11 teams throughout our territory that were providing this amazing work. So yeah, there's quite a few opportunities. Thank you, Ken.
Thank you, Chris. Our next question is for Patrick. Can you please elaborate on the American Red Cross's COVID-19 response globally? And are there plans for the Red Cross to join global vaccination efforts related to COVID-19?
Sure, thanks for that. Yeah, obviously, the movement as a whole has been very much implicated in trying to rise to the challenge of the COVID crisis, and obviously the Federation, International Federation of the Red Cross and Red Crescent movement, as well as the ICRC, have been looking to support national societies around the world where they have been obviously involved or implicated in national health responses and clearly that's been sorely needed in a number of contexts. On our side at the ICRC, what we've been looking to do is obviously to engage in particular with support to authorities for more sort of marginal communities, for example, detainees and detaining authorities, looking to work with them on establishing new hygiene regimes, increasing the availability of hand washing stations, safe water, soap, and the basics of that, as well as PPE equipment and so on and so forth. Similarly, working with forensics authorities over, in trying to ensure that they have what they need in terms of expertise around how to manage those that are dying of the virus, obviously, in particular in mass casualty cases. And similarly with migrants, looking at with the Mexican Red Cross and other national society counterparts across the region, at how they can also adapt their health and hygiene approaches to some of the migrant shelters that they're running out across the region. So, as I say, I think there's been a sort of major sort of recalibration of our existing programming as the ICRC and with our partners out across the world to try to best adapt to this. And obviously, we're also now looking towards the vaccination campaigns. The ICRC, I don't think, is going to get involved in directly delivering vaccines, but one of the things that we're clearly looking to think hard about and to engage with governments and other actors on is precisely how to get vaccine campaigns into areas controlled by non-state armed groups. And given that there are today, in our estimation, some 600 non-state armed groups active in the conflicts where we work, you can imagine that clearly is going to be a big challenge, with some 60 million people living in territories controlled by non-state actors. There, I think we clearly have a significant added value to play in terms of facilitating that access to COVID vaccines in those areas, but it's going to be a huge challenge, that's for sure. Thanks. Oh.
Thank you, Patrick. We have one last question for you, Patrick. And again, we'll be sending out responses through email for those that we didn't get to today. Our last question is, how is the Red Cross responding to the border crisis and helping separated and unaccompanied migrant children reconnect with their families?
Yeah, no, obviously this is a big question today. Obviously for the US, the American Red Cross is the lead on restoring family links. And obviously we've been working closely with not only Koby, but also your domestic services to look at whether there is a role for us to be played in terms of restoring the family links for children and others separated at the border. And clearly there have been historical links between the American Red Cross, the Mexican Red Cross, and the other national societies out across the region. So we're certainly taking the offer of our services more broadly as a movement into the dialogue that we have with the US government. At this stage, my sense is that the US government is principally looking to handle those family contacts in the US at this stage in the midst of this crisis themselves. But again, Koby might be able to speak to that better than myself. On the Mexican side of the border, obviously with the Mexican Red Cross, we have all of this interaction over the shelters that they run, as well, that we support them to provide, and are obviously looking into documenting the experience of those that are being returned, to be able to understand what the consequences, the humanitarian consequences of those returns are, and to feed that into the decision making that the US government is making in terms of its policy reviews at the moment, along with certain recommendations that we may make to them with regards to that. And we're also looking at providing forensics expertise in relation to the missing and dead migrants, because obviously, regrettably, there are a significant number of people that do die making the crossing into the US each year. and it's an issue that obviously not a lot of other not a lot of other actors focus on. But clearly, it has important humanitarian consequences, not only for those that die, but for their families as well. And so we have a forensics expert down in Arizona with whom we do a lot of work, both with those actors that are down at the border itself, but expertise that we obviously bring up to the policy-making level here in Washington as well. So there is a fairly broad spectrum of work that we do in relation to this issue. And obviously, we're trying to bring that into the dialogue that we have, as I say, with the US government at this moment in time.
Amazing. Thank you, Patrick. And thank you all in the audience for your wonderful questions today. We are running close to time, and I'd like to have Chris wrap up today's session with a closing remark. Chris?
Sure, David, thank you so much. Yeah, I just want to thank everyone for attending today. I hope that you learned something. And again, you know, if you're a new Red Crosser, welcome to the family. And if you're a veteran, you know, of the Red Cross, then you know, I hope that you learned something new today. But thank you very much for being here, and have a great rest of the day.
Thank you, Chris. Please keep an eye out for a follow-up email with a recording of this session, along with a quick survey to gather your input. Thank you once again to our amazing speakers for a wonderful discussion, and the thank you to everyone who joined us today. This now concludes today's session.